Assalamu alaikum. This is Zainab Mehdi, roll number 164 from batch 30. Before I start our presentation officially, I would like to thank Dr. Fariha Salman, who supervised us in this project, and all respective batch members who put their efforts into this and made it possible. The members from batch 30 who contributed in this project are Zoha, Zainab, Ali Irfan Sheen, Zainab Kareem, Mudassir Ahmed, Mudassir Muhammad Ibrahim, Muhammad Taha, Zunaira Mukhtar, Bibi Khaza Hussain, Muhammad Daud. The title of our study is Prevalence of Addiction in University Students of Asia, a Systematic Review. The topics of our discussion under the umbrella of systematic review will be abstract, introduction, methodology, results, discussion, and conclusion. Over to you, Ali Irfan Sheen.
I am roll number 311, Ali Irfan Sheen. So abstract is basically a complete summary of our research. Abstract is, so what is addiction? Addiction is a progressive disease which causes individuals to lose control of that substance despite worse effects of its use, posing a risk for disability and premature loss of life. The objective of our research was to find the prevalence of alcohol, nicotine, and cannabis addiction among the university students of Asia. Material and methods included a comprehensive research conducted on PubMed, Cochrane, and Google Scholar in August 2022. In total, 20 articles were included in this research. The results showed that the highest prevalence of alcohol addiction in university students was 66.8%, while that of nicotine and cannabis addiction was 76.76% and 27.3% respectively. The conclusion we drew was that the prevalence of addiction in Asian countries is high and is rising, and alcohol addiction being the most prevalent. The introduction will be presented by me, Zunaira, and Bibi Khalda. Addiction is a progressive disease that causes people to lose control of some substance despite worsening consequences of that use. So addiction is a major factor for disability and premature loss of life. It imposes a barrier against social development and damage to economic and health system. In Asia, over the past 2 decades, there has been an increasing trend in drug abuse involving more than one substance among youth, including students. The highest risk of addiction is reported among students because of academic stress, disrupted sleep, social life, and relative easy access to these addictive materials. The average age of most abusers is 18 to 20 years, and the leading factors include pain relief, curiosity, loneliness, and a friend's encouragement, which proved to be the leading factors. Literature included several studies reported high prevalence of drug addiction in students. For example, a survey of students of teachers colleges in North Thailand showed that at some time in their lives, males are more prone to cannabis and other addicting substances usage than females. There is a higher percentage use of alcohol, tranquilizer, and psychedelics among medical students, and dependence rate is more in medical students because of self-prescription and handiness. Studies measuring the content of ENDS cartridges have found varying nicotine level as well as unlisted dangerous ingredients. Over to you, Zanara.
It's an Mukhtar, roll number 166 from batch 30, and I will continue from where Irfan has left. Ali Irfan has left. The current situation calls for galvanizing policymakers to gear up to this challenge in countries such as those of the Southeast Asia region, where the high burden of tobacco use is further compounded by a large proportion of young vulnerable population, limited established tobacco cessation facilities, and lack of regulatory provisions. And the life-threatening conditions, substance abuse is known to cause severe life-threatening conditions like cardiac arrhythmias, heart failure, myocardial infarction, HIV, and AIDS. And the global problem, the drug addiction has risen to become a global problem in the last few decades, as it is a rising problem in our part of the world as well, the Asia. And our
Right,
study, our
Dr. 10, roll number 312. I will present the continued 2 years Zanera has left. Our study aim is to find out the prevalence of addiction of alcohol, nicotine, cannabis in the university students of Asia. Gap in the literature, there is only a few systematic studies done to investigate this problem among the students of Asia as compared to other continents. The available studies are localized to specific countries and groups not encompassing all the Asian students. The following are the requirements. We aim to access the degree to which students are involved in these imbecile activities and what factor causes them to fall encouraged to these actions. As the students are the key to development of any nation, the rising trends of addiction among them pose a great threat and must be dealt with. Considering the fact we require goal-directed program to control and reduce the prevalence of addiction and organize student awareness program to minimize the destruction caused by it. The objective is to determine the prevalence of addiction, cannabis, nicotine, alcohol in the university students of Asia. Materials and methods.
I'm Zoha Majid, roll number 165, and I will present the materials and methods. This systematic review was in accordance with preferred reporting items for the systematic review and meta-analysis, that is the PRISMA guidelines. Total records that were identified were 1678, and after abstract screening and all those processes, total articles included in this review were 20. We used 3 databases, that is PubMed, Cochrane, and Google Scholar. We used our keywords in the formation of search strings, which were addiction, substance use, cannabis, alcohol, nicotine, students or medical students, Asia, Southeast Asia, or Central Asia. After removing duplicates, a screening of titles and abstracts was performed and eligible articles were selected. Full text articles were then reviewed and articles that determined prevalence of alcohol, nicotine, and cannabis addiction were included. All the published articles from last 10 years were included in this systematic review. Titles, complete text, and abstracts of papers were separately examined by two reviewers and cross-checked by a third reviewer.
Inclusion criteria. All cross-sectional studies, full text reporting lifetime combined prevalence of addiction or lifetime prevalence of cannabis or alcohol or nicotine addiction or abuse among any university students that were published in English language case are included. Exclusion criteria, case reports, case studies, editorials, review articles, employed non-probability sampling or qualitative studies or any studies taken in non-Asian countries or non-English language are excluded. Organization and data extraction. Although most articles put together the 3 substances of interest, each substance was presented separately. 10 reviewers independently assessed the articles prior to inclusion in final review using checklists.
I am Muhammad Taha, rule number 320, present in the results. Specification of studies included total search of database determined 1678 studies, out of which 478 studies were excluded because of duplication. After title, abstract, and full text screening, 20 articles were filtered out for this systemic review, and remaining studies were excluded because they didn't meet our criteria. Baseline characteristics. All of these studies are cross-sectional. Sample size ranged from 100 to 4,261. Only 2 studies had predominantly female participants. while the rest of them had male predominance. Among these 20 studies, 3 were conducted in Iran and 3 in Nepal. The rest of them were conducted in different countries, such as 2 in Lebanon, Thailand, China, and Russia, and 1 study from Bhutan, India, Korea, Mongolia, Myanmar, and Pakistan. And that is shown in the table. The baseline characteristic is shown in the table.
I am Mohammed Ibrahim, roll number 309, batch 30. I will carry on the presentation with the prevalence in our study. There were only 3 studies that reported the prevalence of all 3 nicotine, alcohol, and cannabis addiction. 1 study only reported the prevalence of cannabis addiction. However, the rest of them reported the prevalence of either alcohol, nicotine, or both of them. 17 dealt with alcohol addiction, 11 with nicotine, and 4 with cannabis addiction. This is a prevalence table showing prevalence of the three drugs: alcohol, nicotine, and cannabis in the 20 studies we selected. The highest prevalence of alcohol addiction in university students was 66.8% in Russia, according to study by Resnick. The highest prevalence of nicotine was 76.76% in Pakistan by Nawaz et al. Highest prevalence of cannabis use was found to be 27.3%, also by Nawaz et al. The lowest prevalence of alcohol addiction in university students was in Iran, 7.8%. The lowest prevalence of nicotine was 19.8% in India. The lowest prevalence of cannabis use was found to be 9.88% in Nepal. This is a prevalence chart showing high and low prevalences in the countries of our study. Highest was seen in Pakistan regarding nicotine addiction, and lowest in India, highest in Russia, and lowest in Iran, alcohol addiction.
I am Zoha Majid, roll number 165, and I will present discussion part. We found a lot of differences in prevalence of different substances in different countries, with prevalence of alcohol as high in Russia and as low as 7.8 in Iran. Nicotine was most prevalent in Pakistan with 76.76% and least prevalent in India with 9.4%. This is rather discrepancy because these two countries are neighboring countries. This discrepancy could be because considerably different sample sizes were used in these two studies, or any bias which might have occurred as these studies were questionnaire based. And cannabis addiction was found to be most prevalent in Pakistan with 27.3% and least prevalent in Nepal with 9.88%. Unexpectedly, the prevalence of alcohol addiction was seen more in non-Islamic countries than in Islamic ones, as alcohol is absolutely impermissible in Islam. That is, the prevalence of alcohol was lowest in Iran, which is an Islamic country. Nicotine and cannabis prevalences varied differently regardless of the beliefs. High prevalence of these 3 harmful substances included in our study, that is alcohol, nicotine, and cannabis, impose a serious threat. Alcohol addiction being the most serious among these, as it is found to be a necessary underlying cause for more than 30 conditions and a contributing factor to many more, including many infectious diseases, cancer, diabetes, and neuropsychiatric diseases. Nicotine, which is most preferably used in form of cigarettes, is not free from its side effects either. There is an increased risk of respiratory, cardiovascular, GIT disorders with a weakened immune system and a risk for developing metastasis. Cannabis, which is also being used for medicinal purposes, has a high rate of abuse potential as patients have access to it as in form of medicine, and also medical students have access to it, and leads to serious complications including respiratory and cardiovascular disorders, cognitive alterations, psychosis, schizophrenia, and mood disorders.
This is Medi, roll number 164. The relationship between addiction and students. Students, and especially the university students, are always at a high risk for falling into addiction of substances with a newfound freedom, peer pressure, and an innate desire of trying new things. So, considering the many harmful side effects of addiction, this particular segment of society must be safe. So, how can we prevent the addiction in our society? Awareness programs against drug abuse should be encouraged. Counseling programs involve depression, anxiety, as these are high risk factors for drug abuse. Patients who are indulged in these acts should be identified early and subjected to intervention as soon as possible. Also, a strict check should be there on the selling of the drugs, and all the manufacturers and sellers should be punished according to the law. Other measures, including notifying the authorities about any illegal conduct of drug abuse or drug exchange amongst youth, especially near school, colleges, parks, and other hotspots where the youth is known to spend most of their free time.
I'm the film roll number 310. I'm going to continue from stems of our study. According to our knowledge, this is a first view of its kind carried out to find the prevalence of addiction in university students of Asia. DISMA guidelines were followed and a rigorous methodology was used to perform it. The research strategy was carefully developed and comprehensive in nature. Limitations. The review was restricted to articles covering period of 2022. All the studies edited in the review were cross-sectional. All studies have different sample sizes. Conclusion. The prevalence of addiction in Asian countries is high and rising. Alcohol addiction being most prevalent. Awareness campaigns and community programs should be initiated to reduce this high prevalence to save the continent of Asia from harmful effects of addiction and substance abuse. Thank you.